Hi everyone and welcome. My name is Juliette Korish and I'm with the Queen's Chronicle. Today our segment is on the U.S. CMC and the maternal mortality rate. According to the World Health Organization, the number of women who die in childbirth is estimated and measured via the maternal mortality rate. This ratio equals the number of women who die while pregnant or 42 days after the birth of the child. It's difficult to estimate. Still, it's a widespread and concerned issue for both developing and developed countries. In the USA, the maternal mortality rate is rising. It's at a 26.4. The next developed country below us is the UK, and it's at a 9.2. Women in developing countries do not have access to services, information, medical centers, and they're really inflicted by the poverty of their developing country. The people in the impoverished areas have an increased chance of maternal mortality because there's no access to safe abortions or health care to prevent malaria and the simplest, most basic infections. Here to combat these issues in both developed and developing countries, we have a new program called the U.S. CMC. It stands for the United States Care for Mothers and Children. Here to talk to you today about USCMC is the CEO, Megan O'Donnell. Megan, are you there with me?
Yes, I'm here. Nice. How are you?
Good. How are you, Megan? Listen.
I'm good. Thank you for having me today.
Thanks. Listen, I'd love to hear more about the program that you guys started. What caused you to feel the need to start your program to help these mothers and children?
Well, there's so many places where one could begin to address the problem of mortality rate in the United States, such as the lack of research, education, the lack of support from the community, even the lack of clinics available to mothers of all socioeconomic class, and that is what the United States Care for Mothers and Children is all about. So US CMC is a program strategically created to help reduce mortality rates in the U.S. by providing affordable health care to mothers and children. So our program aims to educate mothers. We would train doctors and nurses on this subject, and we work closely with the U.S. government on reducing complications for mothers before, during, and after the birthing process. So one of the ways we're tackling this issue is by interacting with the community. The clinics hold monthly group meetings with mothers in order to inform them more and answer any questions that they may have. And then our clinics help collect data, and we also encourage local hospitals to collect and analyze data so that we can pinpoint opportunities for improvement. And that way, by collecting and analyzing the data, doctors and nurses can see what they're doing wrong and what they can improve on. Mm-hmm. So with more and more data being analyzed, the nation has an opportunity to address this horrific problem through the generation of awareness and education of this data. For women in America to be supported by the government as they go through 9 months of the most incredible bodily functions known to mankind, the benefits of the program are absolutely limitless. The cultural landscape will change with a knowledge of ways to decrease issues during and after pregnancy is a spread. So I think US CMC plans to have clinics in all neighborhoods so that women can go in and ask questions. We would train doctors, and by doing all of that, then hopefully we can reduce mortality rate and help mothers go through this process so that they don't have to go through it alone.
Mm-hmm.
So.
You're doing an incredible thing. Now, I do see that your first clinic opened up in Charlotte, North Carolina, and it's been open for about a year and a half. How have things been going since then? I mean, have you felt a sense of impact in the community so far?
Of course. I think a lot more women are coming out to the clinics, getting, checkups and asking questions. Before our clinic in Charlotte, a lot of women, especially a lot of women in low-income areas, they couldn't afford to, they couldn't afford hospital visits. Mm-hmm. So by eliminating that economic barrier that prevents women that prevents women from seeking healthcare, then I think we're doing a wonderful job. The women here, when they come in, they're eager to learn and they're eager to ask questions. So I think that's a positive sign from this program.
Absolutely. And it's great that you guys are reaching out to communities who are unable to get any health care at all. What do you think about the statistic of a 26.4 as a developed country, as the USA with the highest maternal mortality? Is that one of the reasons why you guys started your program?
So first of all, I think that with the US having that statistics, I think it's kind of shameful and ridiculous because we are a advanced nation. We have the resources, we have the money for it. So I think it's crazy to see that percentage coming from this country, and a lot of it has to do with the fact that, through Medicare, women are not protected. Women are not, being granted health care. And so I think what we have to do now is not only have the clinics available, but also change the cultural awareness in our government so that when they make policies, when they pass bills about healthcare, they have to make sure that they include mothers as well as children. So,
Megan, thank you so much for joining us. I really appreciate it, and so do our viewers.
Thank you so much for having me.
Awesome. Next, I'm bringing in a nurse from USCMC who will be talking about the impact the program has made on the community. Here to talk more about the program, we have a nurse who works here in Charlotte, North Carolina. Gavriela, are you there?
Yeah, I'm here. Thank you for having me.
Hey, thanks for being here. Our audience enjoys it. Gavriela, can you tell us a little more about your work within the program of USCMC?
Yeah, so I work directly with women who come to USCMC to seek help. And most of the women we work with come to us from low-income homes or homeless, and they don't really have the resources they need to assure not only that they're healthy, but also that their babies are healthy. So what we do is we provide them with doctor visits that they can afford, medicine or prenatal vitamins, counseling, support, and any answers to the questions that they may have. And we not only provide this care during their pregnancy, but we also follow through with them after they give birth to make sure they don't suffer any complications that may sadly lead to death.
Bravo to you on that. Gavriela, do you have a personal experience within the program that you've been working in for the past year that you think our audience would love to hear about?
Well, yeah, I had a patient come to me about 2 weeks ago who was 4 months pregnant and was from a low-income home. And I can't really talk too much into the specifics of her case, but I do know now she's more confident in herself and in how she's going to be during her pregnancy and after.
That's impressive. Thank you for everything you're doing for our community, and I look forward to hearing more about your work in USCMC. Thanks. And next, we have a parent coming in straight to talk about her experience with USCMC. It's one thing to certainly speak to a nurse and the CEO, but I'm about to sit down with a woman who has gone through some troubles and came out on the other side a better person. Hi, Sophia.
Hi, Juliette.
Thank you for being here.
Of course, thanks for having me.
Yeah, so can you tell us a little about your experience with USCMC?
Yeah, so I got pregnant a while ago. I'm from like a low-income family and all that stuff, and so when I got pregnant, I was really worried about how I was going to be able to afford like the hospital visits and the checkups and the ultrasounds and things like that. And so a friend of mine told me about USCMC, said that it's a wonderful organization that would help people like me. And so I went one day and talked to one of the nurses there, and they made me feel a lot better about myself and about how my pregnancy would go and things of that nature. They made all of those services very affordable for me, and were with me throughout the entire pregnancy and also afterwards. They made sure to check up on me and make sure everything was okay. I did have a few health complications that did cause some trouble, but not once did I doubt that I was in good hands.
Have you shared this with your family and your friends that you found a place that you can afford, feel cared for, and safe during and after your pregnancy?
Yeah, anytime anyone I know has any questions about these things or is in a situation any similar to mine, I don't ever hesitate to refer them to the USCMC.
Absolutely. Well, it's great to hear about your experience.
Thank you.
For some closing remarks, I have to say thank you all for watching. I hope you've learned a little something about the maternal mortality rate in America and in developing countries. USCMC takes their job very seriously in impacting both the impoverished and the unimpoverished communities here in America, and we hope that they will continue to impact our community. Thanks for watching again. I'm Juliette, and I'm tapping out.